Hi everyone, so I'm Miss Princess Joy Hetil Sepe, and I'm a student of Bachelor of Science in Midwifery at Camarines Sur Polytechnic Colleges. And I'm going to demonstrate administering intramuscular injection. So first, there are two parts in administering injection, preparation and procedure. So first, let's now go to preparation. The first step in preparation is assess the patient. First, check the client's allergy to medication. In this process, we can do some skin tests to the patient so that we can determine any side effects or adverse reactions to medication. Also, check for tissue integration on the injection site. When we talk about tissue integration, it is about the ability of the body tissues to regenerate and repair to maintain normal. Another is to check the age and weight of the patient to determine the site as well the size of the needle to be used. At last, check for the client's ability and willingness to cooperate. Since we encounter some client or patient that is unwilling to take medication, always do some ways and alternatives just to get the medication to the patient. The second step in preparation is determine. Determine the size of the muscle of the patient. Since our injection is called intramuscular, the patient may vary into infant, child, and adult. So, also the muscular structure of the patient may vary. It is a must and important. The next step for preparation is assemble the equipments and supplies. So we have the medication, the alcohol, the cotton swabs, and as well the tuberculin syringe that we're gonna use for the patient. And the last step for preparation is to check the MAR or the medication administration record of the patient. Follow the key. And now, we're now going to proceed to the second part of administering injection, which is the procedure. Part of administering injection. So the second part is procedure. The first step in procedure is wash hands and observe other infection control like wearing gloves. So after washing your hands, you can now wear gloves. So after washing our hands, as you can observe, I'm now wearing some surgical gloves or any sterile gloves will do. So second step for procedure is prepare the medication ampule or vial for medication. So first, get a clean cotton swab, an alcohol, put some, then get the medication ampule by the neck, and then to get the medication ampule, make a circling swipe on it, like that. After that, get the syringe. So, you can now dispose this. Get a syringe that you can use. Once you get the syringe, you can now pull the needle cap. Get the medication ampule. Tilt a little. Then insert the needle on it. Gently. Then tilt it. Some this. Then pull some. Okay. Now we have patient. The third step of the procedure is provide client's privacy. So, it is part of the right to privacy. The fourth step of the procedure is to confirm the client's identification and information. So you can now ask their name, age, address, personal information. The fifth step of the procedure is to position the client. It is important to position the client so we can have a comfortable um, way of administering medication. So, as you can see, I'm using a teddy bear panda. I'm using his left arm doing the injection. The fifth step of the procedure is to explain to the patient or client the purpose of medication and how it will help them. So talk to the patient, and it is important to use a language that can be easily understood by the patient. Also, in explaining, we must include some relevant information about the medication that we will administer to them. Once you finish explaining the purpose of the medication, we can now select, locate, and clean the site. So first, get a cotton swab. Clean cotton swab. Put some alcohol on it. Get the location or the site of the we're going to be injected. Clean the site. The seventh step of the procedure is to prepare the syringe that we're going to use the medication. So, open the lid of the syringe. Get the syringe. Pull the needle cap of the syringe without contaminating the needle, since it is sterilized. Set aside. Hold the syringe like dart and get the ampule of the medication and inject the syringe on the ampule in a 90-degree angle, smoothly, like this. Then, hold the barrel carefully and by using the non-dominant hand and using the dominant hand, pull the plunger as you aspirate slowly. Now, we can now inject the medication slowly and carefully at a 90-degree angle. Get a dry cotton swab. Apply gentle pressure to the site. It is a must do not massage the area, only pressure. Then, also the used syringe, do not recap it. We have some safety precautionary hazard for medical toxic waste. So we can now dispose it. So once you've done administering intramuscular injection to the patient, you can now remove the gloves and wash your hands. Once you've done washing our hands, we can now document relevant information, including the time we administered the medication, the drug name, the dosage of the medication we used to the patient, as well the patient's reaction to the medication. After a while of waiting, we can now assess the effectiveness of the medication to the expected time it will act. And now, that concludes the demonstration on administering intramuscular injection. Thank you for watching.